So with that, I'm going to pass it over to Cristina Montoya. I know I introduced her ever so briefly at the beginning, and I'm really, yes, there we go. We can pass it on to her in terms of, she's quite active as an advocate in the arthritis community. She's has like almost a lifetime of lived experience, with rheumatoid arthritis and Sjogren's. And she really encourages women with rheumatological conditions to discuss their family plans with healthcare providers openly. So with that, I will pass it over to you, Cristina. Thank you for being here.
Oh, found it. Thank you so much, Lori, for inviting me to this important webinar about pregnancy and arthritis. I know the title is a little tragic, right? It's dramatic, and there is a little bit of hope that I found during my journey, but initially it was a very painful road to becoming pregnant, and now we'll say why. Since you mentioned, I've been living with rheumatoid arthritis for over 20 years. I was initially diagnosed in 2003 when I was about 21 years old in Colombia. And I said that that was the pre-biologics era, or at least the rheumatologists were not as comfortable of prescribing more advanced therapies because they didn't really know much about the long-term effects and safety and so forth. So at that time, I was treated with the conventional medications that were available for arthritis. And unfortunately, I did develop joint deformities and several complications. At that time, having a baby, having a child, even having a family was not my priority. My priority was to focus on adjusting to a new life with pain and unpredictability that comes with living with rheumatoid arthritis, and also adjusting to everyone telling me, oh, you're too young to have arthritis, and being dismissed many times because I didn't have the age to be suffering with arthritis. And then later on in 2007, I met my husband, and he, despite my illness, and he knew what he was signing up for. We got married. We had a beautiful mixed Pakistani Colombian wedding. And of course, he being Pakistani, from a Pakistani background, it was always like he wanted to extend a family, but I was very fearful of starting even that conversation. After a few years, I finally went, asked the dermatologist at the time, and he strongly advised against becoming pregnant. He said, like, no, do you want to have more pain? Like you're just kind of barely living with your rheumatoid arthritis. Adding a child into the equation is going to cause more pain. So who wants pain? I did not want pain. So life went on. And in 2018, unexpectedly, and I became pregnant. Like I said, I was not expecting it. It was a complete unplanned pregnancy. So this is all I can remember feeling: fear, guilt, and shame. I was 36 years old. I was taking methotrexate. So when I took the pregnancy test, home test, to the walk-in clinic doctor, he literally handed me an abortive pill. And I said, you need to take this pill. What? And I said, excuse me. I said, no, I need a second opinion. I need to see my rheumatologist. That was on a Saturday, so I was so fearful. I was so scared, and I still trembled at thinking about it, and my hands sweat. I reached out to a good friend of mine that I met, an other RA advocate, patient advocate, and she told me, no, I'm not pregnant. I can't have babies, but I know who you can talk to. So I reached out to other patient advocates, and they were the ones who told me, these are the questions you're going to ask. So on following Monday or Tuesday, I had the appointment with the rheumatologist or the family physician, And she again suggested that maybe because I was on methotrexate, I should consider abortion. Later on, the rheumatologist, he didn't panic, and he said, I'm going to refer you to a specialist. And did you know that this specialist in pregnancy and rheumatology was located right across the street from my rheumatologist office in Toronto? And I asked him, like, how come you never sent me to him? And he was like, anyway, it was blank. I was this person, I'm gonna say his name because I feel that he gave me hope during my pregnancy. His name is Dr. Carl Laskin. So this man really changed my life during my pregnancy. He is an expert in reproductive immunology and autoimmune disease in pregnancy. So imagine, like, I was so honored to be really seen by this physician. I was 12 weeks pregnant at the time, and my baby was still inside me, but I was still worried about having a miscarriage, because I conceived my baby while being on methotrexate, or if I did miscarriage, I'll have the risk of like spinal bifida or that malformations because of the medication I was on. When Dr. Laskin, he just told me, like, and it's like, okay, it's 12 weeks. You had passed the risk of miscarriage. And I just want you to think about this from now on. Up to 3% of healthy women can have a risk of miscarriage. Your risk increases to 7%. But you know what? You have 93% chance of having a healthy baby. Focus on that 93%. And those words just changed my life. Feel that after that, Dr. Laskin continued to monitor me. He ran labs. He connected with a specialty team at Sunnybrook, and I felt the love from all these interdisciplinary team members working together, so I could save my baby and I could have a fairly kind of healthy pregnancy. So I felt like I had it all. Even Dr. Laskin referred me to Sick Kids Hospital to have me monitor because of Sjogren's. My baby had the risk of a congenital heart blockage. So they did the fetal echocardiograms every week for four consecutive weeks to determine if there was any risk and if they needed to implement any interventions during my pregnancy. So I knew my baby was strong and his heart was fine. The pregnancy went on. I reached 36 weeks. And again, I started now with the complications. My liver enzymes started to increase. So I was admitted to, I can control my slides. I'm still my slides. Okay, where is it? Oh, I'm so sorry.
There should be an option to go back and forth if you need to.
Go back and forth. I'm sorry, I don't see it.
Oh, okay. Let me just quickly share it again.
Oh my God, so sorry. I didn't plan a lot of.
You can also use these buttons on here, like, oops, like the buttons on your keyboard, the flashes. It works for me that way.
It's not working. Could you move it? I only have like 2 more
Yes.
slides and that's
Yeah.
it.
Just let me know whenever you need me to move it.
So yeah, so when reaching this to this point, so that's when also another kind of painful part of my journey began. I did deliver my baby through C-section. It was 36 weeks because unfortunately there wasn't enough amniotic fluid. My baby wasn't growing. So I had my baby C-section. And that's when another part was that my journey was began, and it's painful. It still hurts me to this day. I developed severe postpartum RA flare-up that I wasn't treated. I was developed a severe postpartum depression that wasn't treated. And basically, I moved from being a high-risk pregnancy, getting attention almost every week, to being a nobody in the healthcare system. I was absolutely like, I was no one. My baby did receive the care and attention that he deserved, and I'm grateful for that. But the system completely forgot about me. During my hospitalization after having my baby, I developed complications of pulmonary edema, heart failure, and of course, the inability of breastfeeding my baby. So that just leave me alone. I had a flare for 3 years. And fortunately, you can move the next slide. I was happy to, there you go. So from having this pregnancy, getting those kind of blissful moments during pregnancy, to deciding that, making that difficult choice as a dietitian of not breastfeeding my baby and going into formula, it was a very difficult decision for me. But the rheumatologist who talked to me at the time, she said, well, there's more to feeding, to breastfeeding. You need to take care of your baby, you need to look after him, you need to dress him, and you need to live, you need to enjoy motherhood. And that's where also my journey began again, to get my rheumatoid arthritis back into remission, which lasted 5 years. Now in 2024, my baby, I don't know my baby anymore, but my JK Isaac, and that there's power in that name, because if you have read the Bible, you know, Isaac was a miracle baby, and Isaac means God's laughter, because Abraham and you know, his wife were not supposed to have babies, they were too old, and God says he blessed them with Isaac, and I'm blessed with Isaac. He is the joy of our lives. And just now for like the last slide, I just tell, I actually brought back my baby to the first physician that offered me the abortive pill. And I said to him, what were the questions that the RA patient had told you to ask, if you remember? So yes, so they asked me to basically go back to my doctor. Oh, okay. So I'll respond that at the end of the Q&A section. So what I'm gonna say here is that I have to say to moms nowadays that therapies for rheumatoid arthritis have advanced, and even in that you can become pregnant with RA, but you need that support of an interdisciplinary team for planning and during pregnancy and postpartum. If you have Sjogren's disease, your baby may be at high risk of developing congenital heart blockage. So make sure that you get access to this preventative monitoring. And so the therapies options are available to prevent adverse outcomes. It is possible for you to become pregnant if you are prepared with a plan to mitigate the excruciating pain during the postpartum flare-up. That if you ditch the guilt for not being able to breastfeed when your RA is poorly controlled postpartum, and if you receive postpartum mental health support to be present for your child and prevent suicidal thoughts later on. Unfortunately, that was something that it occurred to me. When suicidal thoughts, I didn't feel adequate as a mother because of my disease. And I don't think there's no mother, no women deserve to feel that way. We should, if you want to be a mom, you should have the support, not only during pregnancy, but at least a year after having a baby. That should not stop. So this is my story. I wanted to share with you. I am happy I'm able to tell the story, and I didn't perish during this journey, and I'm able to enjoy my healthy 5-year-old boy. So thank you so much for having me here.
Well, thank you so much, Christina. Sorry, I think we'll pop me back in, or you can keep Christina in there as well. Thank you so much. And I mean, I'm so thankful, first of all, that you feel comfortable sharing this story. Actually, if we could highlight Christina back, because I think there's a question and I'd like to address that one in the audience. Sorry. There we go. The two of us. Oh, I think we lost her again. Yeah.
Oh, okay. Yeah.
But yes, I know, and it's lovely to see the picture of your little guy Isaac. My goodness, it's a rough story, and it's a challenging one, but I'm glad that things, did sort of work out at the end, despite all these challenges and barriers that you faced. So, I mean, we do have one from somebody, a question. We can just have a couple minutes here in between presentations about, what were the questions that the patient advocate or you talked about a community. It sounded like you had some support, which is good. But, do you recall maybe what some of those questions were?
Yeah, initially I was told to always have a fetal medicine doctor. So they basically told me to just go back to the rheumatologist. And unfortunately, I've met a physician, a primary care provider may not have all the knowledge related to a woman with rheumatoid arthritis. So I think the first step was to really go back to the rheumatologist. And my rheumatologist, even though he was not really specialized in that, he said, you are on a safe medication. So I was taking a biologic Cimzia and prednisone. So he said I was safe at the time, and he immediately just refer me to this specialist,
Right.
Dr. Laskin. So basically was that the family physician, and even they did not have the knowledge and understanding of an autoimmune diseases and rheumatoid arthritis. So that was kind of the
Yes.
first one.
Yes, yeah, for sure. I know. And I mean, Dr. Netta Amiri is here today, kind of speaking to, the depth of knowledge, even as a rheumatologist that we get. So I think that's important. And one thing I've noticed even myself in lots of different healthcare interactions, that sometimes, we don't always, or healthcare providers don't always have the in-depth knowledge needed for these situations. So I have just maybe one question for you, and more specifically, but I mean, you talked about some, maybe some positive things, some not so, some barriers you faced. But is there something that you wish could have been in place that wasn't? What would you recommend if you could sort of make things better for other people facing pregnancy and these sorts of decisions and experiences?
I think in my experience, like the beginning was rough, but I feel like the treatment, how I was treated during my pregnancy was excellent, I have to say. I think that's when they put all the multidisciplinary team together, the gynecologist, obstetrician, they all were really working cohesively. But I felt that they let me down when I had my baby. So I feel like the whole emotional support and after having a baby was very poor. So I wish that not only, I think we're very strong on maybe having the planning, reviewing medications, maybe forming this cohesive team, but the experience doesn't end once you have the baby out of your body. I think that's when another journey begins on how you can be well enough, soon enough to be there for your child. It took me more than 3 years to get there, and a suicidal attempt, if I had to say that. So women should not be getting to that. They should have that support at least a year after. So that was a key piece missing in my journey.
Right. Yeah, no, I think an excellent point and recommendation, and really that's, like you said, it's the beginning of another journey, right? And a long, 20-year journey as a parent, and which is why we'll be hopefully offering or we're offering a second webinar next month focused just exclusively on parenting. But those are some really important points, because it's a long-term thing, and beyond just the immediate support you need in the afterbirth, right?
Exactly. I think one thing that I would say, I would have loved psychotherapy and an occupational therapist. because I think that's the one maybe professional that could have been so important at that point. How to hold your baby, how to preserve your energy, how to really kind of get used to motherhood and parenting, how to even use your seatbelt. There's so many things, the car seats, so many things and gadgets that my hands were not used to. And so I think an occupational therapist will have made a huge difference because they can treat mental health and they can help me to
Right.
be functional. So
Well,
I
that's-
felt that was probably something that would have helped me.
Right. No, I think that's a really good point in terms of what they typically the services that are provided, right? Or the kind of care they can't bridge both. And I know myself too, I had to seek mental health support after the birth of my second child. And it was rough. Like you said, it's a long-term impact on ourselves and on our lives, so thank you so much, Cristina. We will bring Cristina back at the end when we have a general Q&A. So if you have any other questions you think of between now and then, take note of them or feel free to put them in the chat as well. So thank you for being so generous with your story, Cristina. I think it's really important, and thank you for being here.
Thank you, and you're welcome. Looking forward to listening to all the other panelists. Thank you.
Yeah, sounds good. Thank you.